If you're a parent whose child suffers from chronic pain, this video might be for you. I'm Dr. Julia Kovalenko. I'm a licensed pediatric psychologist, and I work a lot with kids, teens, and their families who are navigating chronic pain. When you are working with chronic pain specialists, you're often asked to do things that, for lack of a better word, feel really difficult, feel really hard. It's gonna be tough for your kid, but it's also gonna be tough for you as a parent, because often with chronic pain, there is no quick fix. So the focus is on functioning. I've done other videos on this. You can take a look. But here are two things that I think might be helpful before you really dive into treatment. So number one is going to be that you feel really confident in your child's diagnosis of chronic pain as the primary diagnosis. You feel that your medical team did appropriate workup, basically making sure that you have very little concerns left that something important was missed. Because it's going to be really important that you are confident in the medical team. So that's also why it's important to make sure that you are confident in the medical team, whether that's asking them questions, making sure that you trust them. That is going to be really important. So your confidence in the medical team, the treatment plan is key. Your child will look to you for guidance. Your child looks to you for reassurance. So it is important that you yourself feel really confident, even if maybe you're not absolutely certain about every aspect of treatment, maybe generally you align with your medical team. Number two is going to be learning to tolerate your child's distress. That is something that is incredibly counterintuitive for a lot of parents. No, I lost my light. Which is very counterintuitive for a lot of parents. There are different ways for you to navigate your own distress. That can be going to therapy yourself, or that can be setting up maybe weekly check-ins with your partner. I gave up on my little light. Setting up weekly check-ins with your partner. It can be making sure that you have other really positive interactions with your child outside of helping them navigate chronic pain. That is also a key component of treatment, so that should actually align pretty well. But basically, being able to not show your child that you are distressed is going to be really important, because again, they look to you for reassurance. If you think about it in the very basic terms, think about when your child was little, and if they fell and it wasn't a super bad fall, what they do is they look to you. They look to see, how did my parent react? Are they freaked out or are they calm? And then their response is based on that. Of course, now your child is probably not that age anymore. Some of the same principles apply. And we as humans are social creatures, so even adults do that sometimes, but especially that parent-child dynamic is really important. So if you're a parent of a child with chronic illness, please let me know what else you found helpful before even getting into the treatment.